Hi, this is Kristin Bell, and this is my small tour of the trigeminal nerve, which is also known as cranial nerve 5. The trigeminal nerve is divided up into three main sections: the ophthalmic, which is known as V1, the maxillary, which is known as V2, and the mandibular, which is known as V3. It's also an interesting nerve because it provides both sensory and motor innervation to the face, and it originates in the pons. The ophthalmic section of the trigeminal nerve is the sensory part responsible for innervation of the face and skull above the palpebral fissure, which is basically the space between your eyes, also the eye and portions of the nasal cavity. The three main branches are the frontal nerve, the lacrimal nerve, and the nasociliary nerve. The maxillary division of the trigeminal nerve is the sensory area responsible for innervation of portions of the nasal cavity, sinuses, maxillary teeth, which are kind of the upper teeth, the palate, and the middle portion of the face and skull above the mouth and below the forehead. There are branches that are named zygomatic nerve, infraorbital nerve, superior alveolar nerve, and palatine nerve. The mandibular section of the trigeminal nerve is the sensory area is responsible for the innervation of the buccal mucosa, which is the lining of the cheeks and the back of the lips inside the mouth where they touch the teeth, the mandibular teeth, which are like the lower teeth, and the skin below the mouth, also the anterior 2/3 of the tongue. Now, the motor part is responsible for the innervation of all the muscles of mastication. The branches of this section are the deep temporal nerve, mesenteric nerve, buccal nerve, lateral and medial pterygoid nerves, meningeal branch, and the auriculotemporal nerve. So the trigeminal nerve basically originates in the pons, and it kind of shoots out into the trigeminal ganglion, which is a conglomeration of cells, which then go into the V1, V2, and V3 sections of the face and head. The trigeminal nerve is important for a lot of different reasons. For one, it is the largest cranial nerve, and it covers a large portion of the face. It also impacts eating, chewing, swallowing, speaking. It impacts hearing, which you might not think of when you think of the trigeminal nerve, but it basically protects or is involved with internal sounds, like the sounds you make when you're chewing and things like that. It impacts facial sensations, pain and numbness, parts of the eyes, parts of the nose, parts of the tongue, and even sensations of the teeth. So we've seen that the trigeminal nerve impacts a lot of areas of the face and head, but one affliction of the trigeminal nerve that is somewhat common is called trigeminal neuralgia. And basically, it is also called the suicide disease because it is so painful. It is caused by nerve damage, and the primary kind is where an artery or vein wraps around the nerve and causes irritation. And the secondary kind is when there's a tumor, cyst, or facial injury that puts pressure on the nerve. Symptoms of this disorder, which is really painful, are the first type are you would have symptoms like sharp, shock-like facial pain that comes and goes and may throb. It is triggered by chewing, talking, or touching your face. The second type is a kind of a chronic burning or aching feeling, and it may also have stabbing pain. What a clinician might want to look for is facial twitches, intense facial pain, or loss of sensation in the face or scalp. And basically, if a person comes to you with this kind of pain, they'll likely relate that is quite painful. This concludes my small tour of the trigeminal nerve. I hope you enjoyed your tour, and here are some references of resources that I used to find out the information for this. Thanks a lot. Bye.